strong impression to your attitude or to your personality now? That because of that memory, because of that moment, you changing your attitude or something like that.
Yeah, but very difficult to tell about these moments. But of course, there are a lot of moments, but I can't recall it now.
Do you remember the first mistakes you've done in
practice?
Yeah,
a lot.
I mean the first.
Not the first, but one of them. I can't say the first.
Yes.
But for instance, one day I was resident in a hospital in outpatient department. They brought to me my relative, small child, with foreign body in his ear, and he was brought by my cousin.
Okay.
So imagine at that time, I was a doctor in the hospital, and my relative coming asking help.
Yes.
I said, okay, no problem, I will take this foreign body. And because he was a child, he was moving all the time.
Yes.
Instead, the foreign body is removed. It goes deeper in the ear. So it's very embarrassing.
Very difficult
moment.
Yeah,
very difficult.
Yeah.
And of course, there are some mistakes during treatment of some patient.
Mm-hmm.
But this is part of life, part of work. You have to face some, or you have to make some mistakes.
You will make some mistakes, but you have to go on. Yeah?
Definitely. If you don't want to make any mistakes, you will not do anything.
Yes.
Doing things, you expect mistakes. But of course, these mistakes must be to minimum, must be not too much, to minimum, and not very harmful.
Okay. What is the most important thing being a medical student or being a medical?
I think it's a medical student similar to any student in the university.
Mm-hmm.
But because of the long time or long path, they must be patient and they must study hard. Of course, there is a lot of information given to them. I think study and make the information in your brain according to your understanding, in your language. Put it in this way. What you learned from your professor, from your lecture, you have to manipulate it in your mind, so you will understand it more. And of course, you have to be patient, as we said, and time will go until you will finish your study.
Actually, a lot of my friends, which not from the medical field, they said that medical students have no life at all because they just have to study and reading books.
Not 100% true. It is true that medical students must study more than the other students.
Yes.
But it doesn't mean that medical students only study all the time. The medical student must exercise, must take some days off. It is essential, it is important. Otherwise, if you are studying all the time, your brain will become tired.
Yes.
Brain like a muscle. It must be giving a break to it.
Okay. Okay, we're reaching the end actually. So do you have any last words you want to say to motivate as students? Because real students are like it's tired enough to studying medicine. Why sometimes we doubting ourselves why we take this pill, and so you have any words to motivate?
I think studying medicine is rewarding. I mean, as I said at the beginning, if you are interested in this path, I think it is rewarding. you will see it when you are treating patients and see their thanks in their eyes. Even they are not saying to you thank you verbally, but it will be seen in their face. In addition to that, your self-esteem. I mean, you will feel that you did something good for human beings. I think medical practice or medical profession, I think, is rewarding, personally and socially.
Okay. I think that's the end of our interview.
Thank you very much.
Thank you, Doctor. I feel moved when you say that actually this field is rewarding because
it is rewarding.
Yes,
it is rewarding.
Because when we're meeting patients, right, our end goal is to meet patients and to make their life better. I mean, in health aspect.
Yes.
So when it is becoming better, it's like a reward to ourselves, right? Yes.
Definitely. At the end, all the best for you as Malaysian students. I like them. I like you. I like Malaysian students. They are polite and they are sincere and they are really hard workers. So all the best for them.
Okay. Thank you, Doctor.
Thank you. Thank you.